Hey, you guys. Dr. Melanie Carlone, and I'm here to dive a little bit deeper today into fascia and how old scars can have such a profound effect on us down the road. You know, that kind of ankle that you might have sprained in college, or a fall that you had years ago and cut yourself and it totally healed. The tissue closed up, the pain went away. You don't even think about it. And yet you may notice something often beyond it feels different. The movement of it maybe pulls, you can see the skin wrinkle, or the range of the joint around the area or beyond the area is limited. Or it could even be something quite far away, like your foot when you've done something to your hip, or your knee when you've done something to your back, or your jaw when you've done something to your arm. It all started hurting, and long after the original injury. The fascinating thing is it's not a mystery. It's actually fascia, that crazy connective tissue that connects everything to everything, and we don't even really fully understand it. So today I'm going to walk through what we do understand and what you can do about it. So, as I said, I'm Dr. Melanie Carlone. I'm a physical therapist. I'm a somatic practitioner. I'm a lifelong learner into things around breath and nervous system education. I'm a double 200-hour yoga instructor, and I've had 40 years, it's hard to believe, of clinical practice. And I work with people living with chronic tension and pain that doesn't resolve. A lot of times people who've been kind of train wrecks and damaged by the medical system end up coming to me with bodies that kind of feel stuck in old injuries and patterns that don't make sense, things that happened a long time ago. I like figuring that stuff out. So in this episode, we're going to go deep into thinking about fascia. What actually changes in the tissue after an injury, and why those changes can disrupt your body years or even decades later. And what can you do right now to help your body find new options and to get out of old patterns that may be limiting it? So whenever you have an injury, it creates a protective strategy in the body. Your nervous system responds instantly. It reduces load to that area. It sort of tightens up and contains, and then it tends to move towards the midline. And that effect can change how you move. It recruits other parts of the body to protect that injured site, and it's smart. That's your body doing exactly what it's meant to do. If you sprain your ankle, you walk differently, right? If you injure your shoulder, you lift differently, or you hold your arm differently. And it's not a problem, it's a protective strategy. So thinking about that way makes a difference. And once the tissues heal, those strategies don't automatically turn off. And the reason why is inside the fascia itself. So what really happens inside of a scar? Well, when tissue is injured, the body rushes in with fibrin and collagen, like the building materials of repair, and they fill the area, kind of knit it back together. They close the wound or the bruise, and it's a beautiful biology. But here's what most people don't recognize. That fibrin and collagen, they're actually acellular. They don't have cell structure. They're fibers, and they don't lay down in the same organized fluid pattern as the original fascia. They, like a bird nest, they're irregular, they're adhesive, and that density doesn't just restrict movement, it disrupts cellular communication, it disrupts flow of fluids through the area. Think about what fascia actually is. It's not just like a plastic wrapper, it's this amazing living communication network. Nutrients flow through it, nerve signals travel through it. Cellular information moves through fluid pathways all the time, every second of every day. It's always there helping you. So when scar tissue forms, it creates a density. Some people might say it blocks chi in the middle of that network, like a traffic jam inside the body's highway system. Communication slows down, the signals get distorted, the tissues downstream stop getting clear information. And this is why. If you've had an old knee injury, you can notice down the road you start getting foot neuropathy even years later. Not because the knee is damaged, but because that fascial disruption changed the communication little by little, day by day, step by step, all the way down the line. I had a client the other day who came in with a pretty severe ankle injury when she was 15, and now her knee's bothering her, and we saw the connection. Maybe it's an old shoulder injury, but that can also show up as neck tension or jaw tightness years later because the body adapted. I often talk about it like, think of a fishing net hanging and you pull one corner, everything changes, adapts, and the adaptation travels through the whole network. So what can change this? Restoring communication through the fascia. And there's different paths to doing that. One of the brilliant ones I use is microcurrent, but most people don't even know about that. So today I want to practice what you can do that's in your own hands and doesn't cost a fortune. Let's think about how fascia connects everything. So it's a continuous loop, and it's a fluid loop. It's constantly changing connections. It's not a static thing. What happens in one place redistributes across the whole of the fascia network with these electrochemical signaling. So an ankle scar will influence your knee, and the knee pulls on the hip, and then the hip shifts slightly in the pelvis, and then the spine doesn't want to be sideways, so it adapts on top of that. And over time, it just sort of becomes normal. But people recognize like something always happens on the right side of my body. Or first it was my right knee and now my left hip. So that moving around is very common. And it's not optimal, obviously. The nervous system isn't just tracking your tissue. It's tracking the safety that you feel inside of your body. So when you move and it doesn't quite feel right, it distributes that throughout the body. So instead of asking, is this scar healed? That scar doesn't really bother me anymore. A better question is really, does my body feel totally safe moving through that area and with that area again? That's an interesting thing. Most of us are kind of cut off at the head. We don't really necessarily feel our body. So we practice starting to pay attention. And how's the best way to do that? Start with ease and kindness. Now, here's a principle behind everything that we're about to do. It's sort of the foundation of somatic work. Every restricted movement has a direction of ease, a direction where the pain goes away, where you stop pulling on the tense fascia, so your body stops bracing. A place where when you move into it, the protector inside just kind of relaxes because it doesn't need to be vigilant because there's no strain. So we're going to do a practice to find that direction. And I want you to think about your own direction of ease. Then we're going to move in to the restricted range, just to the beginning where ease ends and restriction begins. And right there, at that threshold, we apply a gentle, what's called an isometric contraction into the restriction as if you were moving out of it, right? It sounds confusing, but I'll walk you through it. You basically contract the muscles that are holding you from moving further into the restricted range, the protectors. And we don't fight them, we honor them. And you don't do it hard, and it's never painful. Pain is not something that should be associated with physical therapy, in my belief, and it often is. It doesn't need to be. But with time, patience, you build slowly, maybe 50% of your effort below the pain threshold, but very consciously. And you hold that, and then you release very slowly over a slow count. I usually count slowly to 5. Fully soften, but consciously let go. And then we're going to re-explore what was previously restricted. Now, what just happened when you do that? Well, the nervous system receives some important messaging from you. First of all, that you're paying attention to it. That's huge. So the primitive brain gets that you're paying attention. It's also getting the message that we can go into the restricted range and be there and don't have to brace. I can tense and let go and tense and let go. And the bracing is actually not needed because you're safe. And when that message lands in the primitive brain, that constant tension often softens and range opens. Not through force, but through permission. So, before we go into the practice of softening the protector, just take a minute. Where's an old injury or scar that feels different to you? Not necessarily painful, but just not quite the same. You're affected by it. And put a comment. I pay attention to them. You're not alone there. And if you're new here, welcome. Please subscribe so you don't miss what's coming next and you keep me able to do what it is that I love to do, which is bring this information out to the world. So let's start with the shoulder. I'm going to use my own shoulder as an example. An old injury, a skiing injury where I tore the labrum. It's a big one. They wanted to do surgery. Didn't want to go there. But what's happened over the years is my external rotation in this shoulder has been limited. And now, this is how far I go on this side. This one starts to brace. Okay? So that's my restriction. So if you have shoulder injury, let's do this. If you just want to watch, you can apply this anywhere. So first you're going to find the restriction. I'm going to slowly bring my arm outward just where it feels limited. It starts to be discomfort right there. And I'm not going to push it. If I go back here, it's a little tighter. All right? So I can notice that. Now, the direction of ease is in, of course, across this way. So if I am externally rotating, then the direction of ease is the opposite. And that's pretty much true of any joint. So if I'm rotating in my spine, I'm tense there, the direction of ease is coming out of it. Okay? So let's move to where the protector is. Protector relaxes. Protector kicks in. All the muscles here are like, don't do that. Okay? Now, right at that edge, I'm going to stop, and I'm going to imagine that some force, some unkind force, is trying to push me further. Okay? So in my shoulder, I'm going to imagine someone's trying to push, and I'm going to hold. And what I'm doing is I'm holding the protectors, the internal rotators. And I'm going to build it slowly. Tense, tense, like up to 50% of my effort. Doesn't have to be really strong. I'm not going to force it. Just a gentle, steady contraction. So as if someone was pushing here, here, and here. So that's the protectors. And now I'm going to release very slowly. 5. Breathing in the low back. 4. Eyes soft or to the side. 3. 2 and 1. See how slow I go. Very consciously. And now I re-explore. Can I go out further? Look at that. You notice that? What's different? And you don't have to believe me. You could think I'm making that up, but try it yourself. There's more range. There's less bracing because I brought the protector in, and I let it go. There's a different quality of the sensation now. If I do that a few more times, that's my body updating the pattern. And if I do that regularly, the fibrin, collagen, the tension in the scar starts to change. All right, let's do the same thing. Let's find the protector in the ankle. Old ankle sprains, which many of us have, almost always leave a fascial restriction in inversion. So being able to bring the foot in is limited. This foot I actually dislocated and fractured both bones, falling off a horse. So I've got a lot of stuff going on in this foot. And believe me, that tissue density doesn't just affect my ankle, but it goes up my chain into the calf. This is the knee that I end up having problems with. Sometimes even the foot itself, there's numbness and tingling. Long after that ankle healed, I was 15. It was a long time ago. So let's work with it. So sit comfortably, okay? And it's good if you can bend your leg, ideally, but that doesn't always work. You can put your leg out straight, but then you pull your hamstrings in. So try to do this with the leg bent and suspended. And just do a circle and find where that ankle feels limited. Toes spread, toes curl around, lift, spread, okay? And go the other way. And find the direction of ease. So for an ankle that's been sprained on the outside, going in, it's like pulling. It doesn't want to go. But if I go outward, it's easier. So that's my direction of ease. So we're going to work with that. I'm gently going to evert, turn my ankle outward, and let it settle there. I can check it again, bring it back in and out. Okay, now I'm going to go into the restriction, bringing it inward right where it's discomfort, right? So I can't go in, I'm a little limited there. Now I'm going to stop there, and I'm going to contract the muscles that are preventing me from coming in. So imagine a hand trying to push me further into my stiffness, but I'm not going to let it happen. So that is me honoring the protector, pulling in the everters. So my hand is here, and I'm just going to hold. Spine, ear over shoulder over hip, body's in ease, the lateral protectors building to 50%, holding, breathing in the low back, and then softly letting go. 5, 4, 3, 2, and 1. Now, here's another thing you can do. I relaxed, I went a little further. It's hard to see. Now I'm going to hold it in the new place that feels easy, and I'm going to do it again. So I'm going to hold my foot here. I'm going to imagine I'm trying to pull it further into the restricted range. So the protectors want to move me into the ease. I'm going to hold it. Hold, don't let it go. Hold, build it, hold. Keep my foot right where it is. I'm not going to go further into the restriction. Breathe. Eyes to the side, telling my nervous system it's safe. Breathe. And then I slowly let go. And as I let go, I'm not trying to force anything. I'm just relaxing. 5, 4, 3, 2, and 1. And there it is, just a gentle softening. Even a small shift tells you your nervous system's listening, okay? So my foot goes further into inversion. And there's just an ease there. It's really pretty crazy. So, quite remarkable, eh? We did the shoulder, engaging the protector. We did the foot, engaging the protector. Let's talk about hips. So if you've had an injury in your hip or low back, there's almost always a subtle pelvic shift. Your body tends to move weight away from the injured side. So for me, that was my right low back. And the fascia, that really dense, what's called the thoracolumbar fascia, the hip flexors, the IT band, it all reorganizes around that shift. So years later, the shift is still there because it's been built up step by step by step. The scar tissue never got the message, hey, this is safe, let's come back. This is pretty interesting. So let's practice a hip rotation. Some of you probably have difficulty if you sit on the floor sitting cross-legged and having your hip roll outward, right? It's difficult. So I want you to bring your leg up. You can do this sitting. You can also do it standing and practice letting the hip roll outward, but it's easier if you do it sitting. So go ahead and let the leg roll outward. Tension. Inward is easier. Outward, the protectors trying to pull you in come in, all right? So relax the leg, bring your awareness to it fully, move towards the restriction, just the beginning. Now, contract the muscles that want to bring you into ease, which means the rotators. How do you do that? Imagine a big giant hand, a force that's trying to push you in the restricted range, and you're going, no, I am kinder to my body than that. So I'm going to hold my hand here and not let my leg go out. I'm testing the internal rotators, the adductors, all the medial stabilizers of the leg. And I build up to 50% and hold, breathe. Eyes to the side and then relax. 5, 4, 3, 2, and 1. And my leg just dropped like 3-4 inches. It's amazing. Okay, that new range, I'm going to do it again. Trying to push, the protectors say no and resist me. There's no pain, and I hold. Pushing 50%, let my eyes go soft to the side, breathe. Thank you, protectors. Thank you for the protection, for the holding. And now I'm going to release. 5, 4, 3, everything softens. 2, 1, and the knee just drops. It's so crazy. So my internal rotators let go and let my hip go out. It's really quite remarkable. All right. Now, let's talk about knee injuries. I hope this is making sense. It's interesting to try to do this on video. So with knee injuries, I want to say something important. Fascial disruption from a knee injury is one of the most common reasons that people get foot neuropathy, tingling, numbness, burning years after the knee healed, because that scar tissue density has been disrupting the fascial tube that carries nerve signals. It carries the nerves, the arteries, the veins, the lymphatics, and when communication is disrupted, pain downward happens. But when communication gets restored, symptoms start to soften. So, if you are one of those people that has a difficulty straightening your knee, and there's a whole bunch of reasons why that can happen as we get older, that can become quite difficult. So, seated, put your heel on the ground and push your knee down until you feel restriction, discomfort. Just notice where that is. Let your leg come out, go back into flexion, and then once again, slide your heel out, heel on the floor, and feel where in extension there's the beginning of that restricted feeling, like you just can't go further. Now don't force it. You're going to stop there, but you're going to tighten the protectors that keep you from straightening your knee, which is the hamstrings, the muscles holding the knee in an easeful position. So the way to do this is put your heel in the ground like you're trying to paw the earth. Put your heel in the ground and press slowly. Press and build 50%, but easy. Feel the contraction, stay aligned, ear over shoulder over hip, eyes to the side, breathing. And then softly let go of the hamstrings, pushing your heel in the ground. Release. 5, 4, breathe. 3, 2, feel the whole body soften. 1, and just notice if your knee goes a little bit further, which probably does. And now in the new position, hold it there, no pain, and do it again. Push the heel in the ground, stay upright, eyes to the side, telling the nervous system this is safe. Push the heel in, tighten the hamstrings like you were going to pull your heel to your butt, but you can't because it's on the ground. Feel it, 50%, and release. 5, 4, soft, 2, and 1. And now let the knee go. Re-explore that extension. And notice what changed. So if you're someone who has foot symptoms, tingling, numbness, notice if they shift too. Often it takes a while for that lubrication and communication to get back into the nervous system. But you may notice, if you have neuropathy, do this through the day and see what happens. I also highly recommend with neuropathy, get in the habit of moving your ankle, circle one way 20 times, the other way 20 times, point and flex. Re-own communication with feet down the line. Soften the fascia. Open the channels that have been closed off and be amazed at the difference it makes. All right, let's integrate everything. Let's do some back body breathing and a cross body reset, because it's always about getting the nervous system and communication to work as a whole. So if you put your hands on your low ribs or you lean back into a chair, if your arms don't go up easy, breathe into the low back. Feel the ribs expanding backwards and sideways. And then just exhale. Let your out breath be a little longer than your in breath, softening the nervous system. This reduces the whole front body bracing and invites the whole system to settle. 3 breaths, breathing into the low back, breathing out slowly. And again, with awareness behind you, softening vigilance, quieting the nervous system. Feel the ribs expand back behind you. Breathe. And then soften, let go. Now integrating right and left hemisphere with sensory information. Reach one hand lightly to your opposite shoulder. Pull in and cross to the hip. Reach across to the other side, pull, and cross to the opposite hip. Do that 3 times. Telling your body, we are a whole unit, supported. I have the ability to be aware of my entire body. Top to bottom, bottom to top, left to right, right to left, front to back, back to front. That's when the whole system feels connected. And the need to protect or isolate areas quietly softens. You begin to reclaim lost parts of self. So in a way, it's not about erasing what's happened to you. It's updating what the tissue learned and where the protector has been. It's letting the protector know you're there now. The scar remains. The fascial network is doing what it's doing, but communication starts to be restored through your attention through areas that have been affected and isolated. And over time, that density softens. The pathway through the scar opens up. So when we work with our systems, when we understand them instead of against them, and you honor the protector, before you force it to release, you honor it, the body often finds new ways to move with safety, ways that feel lighter and more supported, just integrated. And it's not through force. It's literally through permission and your compassionate attention. So if an old injury or scar still affects how you move, it doesn't mean something's wrong. It means your body is amazing and it adapted. It means the fascia is still holding a story, and stories can be updated. Not by erasing the past, but by giving that tissue new information with your intention, new options, new safety. Your body is not broken. It's always been trying to protect you. And protection, when seen and understood and given permission to soften, becomes literally freedom in yourself. So if you tried any of these resets, I want to hear from you. Please drop a comment. What was it like? What changed? What did you notice? Even a small shift matters. I'm really curious. That's how your body learns. And by speaking it outward, you ground it. So if this resonated, stay here, like, subscribe, share it with someone who has old injuries that never quite resolved. And move with kindness. Give yourself compassion, especially in these challenging days. Breathe with awareness. Trust that your body is always and forever trying to help you. Safety awareness first, kindness and compassion. Change comes second. I'll see you next time, you guys. Thanks for being here.